Morning and welcome to STEM Ambassadors Live. Today I'm joined by Sarah Batts-Williams, and Sarah is going to talk to you about what it's like to be a veterinary nurse and how STEM comes into that. I'll hand over to you, Sarah. Thank you.
Thank you. So a bit of background, I guess. I'm the co-course director at the Royal Veterinary College for the undergraduate veterinary nursing courses. So it's quite a mouthful, but basically I work at a university training students to become veterinary nurse students. And then I also support other sessions with sort of biovet science students or scientists, and then also the veterinary students too. So you can see with my post-nominals there, I've got a BSc myself in veterinary nursing, and then I've also got a master's in education, and that's what some of the post-nominals are about. The FHEA is my teaching, be it like part of my association to teach, and then the RVN I'll explain as we go on. So just a bit of context there. So I'm just going to briefly talk about the role of a veterinary nurse, the routes of training available, and how STEM fits into all of this. And what we're going to look at is how sort of the science actually underpins the care that we provide. And hopefully you'll at the end see if this is a career that might interest you or something you think, no, definitely not for me. That's absolutely fine, but at least you'll know either way. But hopefully at the end, yeah, I've piqued a bit of an interest in you and you want to go and have a look at this further. But it's quite a short talk, so we're going to whiz through it a little bit. So as you saw at the end of my name, I've got RVN, and that's really, really important because it tells everyone that I'm a registered veterinary nurse. And what that means is that I have demonstrated that I've learnt the appropriate information and demonstrated all the appropriate skills to be a trustworthy veterinary nurse and someone who can look after your pets. And interestingly, that only began, so being registered only began in 2015, which really isn't that long ago. And so that means that we're a very young profession. Now, there was nurses around before this, but you didn't have to be registered. And actually, you still don't have to be registered. You could call yourself a veterinary nurse and not have demonstrated all of those things. So that's why it's so important that I put RVN and use that so the public know that I am registered, I could be struck off, I have been through training and yeah, accountable for my own actions. And there's lots of changes going on in the profession because of that 2015. It means actually it's very new, it's very exciting. The other day, our representatives from veterinary nursing were at the House of Lords trying to get laws changed around veterinary nursing and protect that title, so no one except for registered veterinary nurses can call themselves veterinary nurses. So yeah, lots of exciting changes at the moment. The training, you have to demonstrate academic capabilities and practical skills as well. So there's no point us sitting there teaching you just about how to take a blood sample and you never actually take one. So you have to then show that you can take one too. And it's a really interesting profession. It's a bit like human nursing used to be, in that you can enter via a diploma at level 3, which is college level, or a degree. And that doesn't change what you can do as a veterinary nurse, but I'll explore the differences in the next slide between those two. But what it means is that hopefully it's open to all, whether you need to work or you're better at like more practical skills and you want to work practically predominantly and then study maybe 1 day a week on the theory side, you can go for a diploma. Or if you think actually, what was that, sorry? So there's feedback. Oh, sorry, I thought I heard something. Or if you do a degree, then you'll be learning in lectures, in different degrees run in different ways. So it might be that you're there for a whole week, the whole month, say, and then you go out into placement, or it might be that you do a couple of days at university and a couple of days in placement. And there's different pathways, so you can either go down a horse pathways, equine, or you can look at just small animals. And when we say small animals, that's dogs, cats, and exotics. And exotics sounds very fancy, maybe you're thinking zoo animals, but actually rabbits and guinea pigs come into exotics too. So when we say exotics, we mean, yeah, rabbits, guinea pigs, hamsters, but it also can include things like snakes and lizards. It really depends where you work. If you work at a small vet practice, then perhaps you'll get those more rabbits and guinea pigs. If you work next to a zoo, then you may be that zoo's vet and then get your true sort of exotic animals. And as I was saying earlier, that registration, that RVN, means that I'm accountable and answerable to disciplinary hearings, so I can be struck off if I do something wrong. And that's really important because that means that I'm going to keep up my education, I'm going to be really careful about what I do and make sure that I'm up to date with my learning so that I don't make mistakes and I don't sort of get behind in my knowledge that leads me to not be the best nurse that I can be. And student veterinary nurses, so that's the SVN, and registered veterinary nurses can undertake Schedule 3 procedures under the Veterinary Surgeons Act. And what that means is we're allowed to do certain things that other people can't. So we can do things like taking blood and giving medications, performing minor procedures, things like that. And actually that's what's changing at the moment. That's why they're going to the House of Lords at the moment and trying to change this, because 1966, I think that's the last time England won a World Cup. So a very, very long time ago. Oh, actually men's football, we should change that now because we know our ladies have won the Euros. So what does a vet nurse do? Well, we've got our visible roles, so things like working in an emergency unit. So that's a picture taken from my work. We've got a big university teaching hospital. We've got a vet nurse there getting access to a blood vessel on a dog that looks fairly collapsed. There are quite a few people holding him, so maybe he's still a little bit alert, but he is laying on his side and he's in the emergency room, so I imagine he's pretty poorly. So that's Steve trying to get a blood sample there. We've got nurses who work in rehabilitation, things like hydrotherapy, working with underwater treadmills. That used to be a lot of like post-operative care, but now if we think there's lots of dogs working and in sport, like agility and things like that, actually that field is growing and rehabilitation is becoming sort of increasingly popular with owners. We've got Ali working in theatre down on the bottom left, opening up packets of instruments, and we'll look at some of her work later in the slides. And then we've got our sort of client contact, client education as well. And then we've also got lots of invisible roles. So our role is to care for that patient rather than cure them. Obviously by caring for them, we're helping to cure them, but that is our main focus, is that care while they are being cured. We advocate for our patients, so we try to stand up for their rights. We think about what the owner would want, how that fits in with their lives, and what that patient would want, because they obviously can't speak. We're with the patient more than perhaps the veterinary surgeons are in most circumstances, because we're in the wards with them. We may have more of a relationship with that owner because we might have done, you know, all their puppy classes or kitten classes. And so we try to be that patient's advocate. We focus on the patient's quality of life. So always thinking, okay, we're not just extending their life for the sake of it. If they're really miserable and they're in pain and they're suffering, we're focusing on how good their life is. And then we also have ethical discussions. So if we think that perhaps we're coming to the end of that patient's life, then we can talk about ethically, you know, where do we go from here? Are we doing the best by that animal? We're also involved in evidence-based learning and lifelong learning and education of owners, the public, other vet nurses, vet students, veterinary surgeons. We sort of all help each other. So that's a bit about what a vet nurse does. And then I sort of spoke about the entry qualifications earlier. You can go from your GCSEs into a level 3 diploma at college, or you can go do your A-levels or do a college course and then go on to a degree and either do a foundation degree or a BSc degree. Now, for those that have looked at degrees at the moment, or they're sort of starting to look or start to think about that, you might see that actually these degrees are very long. So a foundation degree is 3 years long, which is normal, sort of the normal length of a BSc. And the BSc is either 3 or 4 years, depending on the university. So again, quite long, 4 years for a BSc degree. And the reason for that is that you have to do a lot of time in practice, so 1,800 hours in an approved training practice. So quite a lot of the time you'll be working in a veterinary practice alongside your studies, and that's why the courses are so long, and you have to do that to become a registered veterinary nurse. Either way, as a diploma or a degree nurse, that's what you're going to do. And that just makes sure that when you come out as a veterinary nurse, you are ready to work. So obviously you're not going to come out as an experienced veterinary nurse, but you're going to come out as a veterinary nurse who can actually do the job, which is pretty incredible, because if you think about a lot of other degrees, you know, there's a lot of learning to go afterwards. And whilst there's a lot of learning in veterinary to keep up with everything and, you know, to always improve the care you provide your patients, you will be able to physically do that job, and you could be relied on to do that job. While you're in practice, you're completing a log demonstrating your competency, and you also you're supported in that. You have a clinical coach who's watching out for you and helping you gain the right experience at the right time. So that's your nominated person. But the best thing is, for all veterinary nurses, whether you've got a diploma or a degree, is there is so many job opportunities after qualification. So getting into veterinary nursing is quite challenging. There's a lot of competition for every single university or diploma place. But once you're qualified, there is so many jobs out there. So I will get daily emails asking me if I want to go and work in practices from sort of locum companies and things like that. There is a real need for veterinary nurses. So whilst getting onto the courses is fairly challenging, because of you have to go to an approved training practice, you have to be looked after by a nominated person. That restricts how many nurses can qualify at one time. When you're actually out there, the world is your oyster. The differences between the diploma and the degree is that you're being assessed at different academic levels. So, you know, if you're on the diploma, then you're being assessed at a level 3, which is sort of A levels. If you're on the degree, then it's level 6 or level 3 or level 4, whichever one you're doing. And that means you're going to have to do a whole nother step up of referencing, analysing information, producing research, that sort of thing. Students with a degree can apply for degree level jobs, so graduate level jobs, and work in further education. So if you've got a degree, then you can teach at degree level. Whereas if you've got a diploma, you won't be able to teach at degree level. And also at university, you get that university experience. You can go around to different placements. You can pick and choose where you go within reason. You've got the sort of social side of university and all those opportunities that brings, but you aren't paid when you're in placement. Whereas if you're an apprentice on the diploma, you're paid while you're in practice because you're an employee, but you obviously don't get that university experience. You're coming into college once a day, and then you're going back to work, and so you're working straight away. But something that again is very new, so this is again why it's such an exciting profession, because there's lots of developments. We've recently had a post-registration framework approved, and that focuses on research and leadership skills. And so what that means is anyone from the diploma can be bridged up through to a postgraduate master's level, and the same on the degree. So you can be bridged up to a master's level, and then once you've got a master's, you can go on to PhD, whatever it is that you want to do. So actually it's really nice now, because we used to have sort of degree nurses being able to progress and diploma nurses getting a bit stuck, but now the diploma nurses can jump and be bridged up all the way through to PhD level if they wanted to. The only thing that's holding us back, as I said, at the moment, we've got people going to the House of Lords for us, trying to change that act, and the Veterinary Surgeons Act, is that the legislation remains the same from 1966. So it doesn't really represent what we can do. So what we can do for now stays the same, but we are working to change that. And I thought I'd just show you some opportunities that I've been lucky enough to experience, or sort of colleagues and friends of mine that have gone on to do. So when you're a veterinary nurse, you can work in a variety of practices. So you can work in private practice, university practices, first opinion, referral, charity. You've got lots of options, and you'll find one that fits you. You can work in a certain specialty. So you could be a general nurse, or you can work in theatre and only ever work in theatre, or you can work in neurology or dermatology, whatever it is that sort of takes your fancy. You can go and work in wildlife conservation or in zoos. Again, those jobs are very, very competitive, but they are there to available to you. You can travel with your qualifications. So I've worked in America, I've worked in Australia, and I've worked in South Africa. You can teach, so a bit like I do now, you can go around and teach at that diploma level or degree level. You can go and teach qualified nurses in practice, working for sort of companies. You can go into research. I've got friends who have gone into research and now are researching biomechanics of human movement and how it's affected by different neurological conditions. If you're sort of a bit more business minded, you can go into sort of insurance or practice management. We've got nurses who are owners or partners in veterinary practices now. Veterinary nurses in military, so that's definitely an option, and then all the opportunities that being in the military provides, so travel and things like that. You can work as a sales rep, go into different practices, selling different things if, again, you're sort of more business focused. And there's lots of leadership opportunities as well. So you can go and work for the governing body, or we've got sort of associations like the British Veterinary Nursing Association, and you can go and work for them or volunteer for them. So that's just a snapshot. There's a picture of me putting a catheter in a rhino's ear, taking blood from a crocodile on a research project, and we had a baby kangaroo come in to our practice. Obviously, these are the amazing opportunities. You know, you've got to look after the everyday animals too, but that's just as fulfilling, I think, the dogs and cats and rabbits and guinea pigs. So in the next few slides, I have got some images, which they aren't too gruesome considering it's Halloween, but in 2 slides time, there is some images of blood. So if you want to close your eyes, you are more than welcome to. But how does STEM fit into all of this? So why is it a sort of STEM role? Well, if we just have a look at the science side of things, we've got a 12-year-old domestic cat called Tab, so just a domestic short hair, your normal sort of cat, and they've been diagnosed with hypothyroidism, and that's a really common condition. And where science fits into this and the veterinary nurse's role is we need to understand what the thyroid gland does in order to know what happens when it goes sort of wrong. So the thyroid has a range of functions, but it produces hormones, and that supports metabolism. So if we think, okay, metabolism is being affected here and the patient has hyperthyroidism, then we know that the thyroid gland has gone into overdrive. And so we're going to see all of those things in their metabolism. So they're going to be hyperactive, but they're going to be underweight because they're eating loads, but their metabolism is working so fast that they're losing weight. They might have high blood pressure, and that can cause vision loss. And so you can see that just understanding the science behind what the body does, then you can start thinking about what happens when it goes wrong. Then we can think about diagnosis. So although the nurses cannot diagnose, that's the vet surgeon's role, we support that diagnosis. So we'll be looking at clinical signs and getting that from the owner and monitoring the patient in the hospital. We may palpate their thyroid gland and notice that it's enlarged and sort of say to the vet, okay, I think you need to check that out. We'll be taking blood, running blood, and sort of providing the results. And that's normally the level of diagnosis we go to for hypothyroidism. But then all of this, what we're trying to think is how do then we actually bring all of this together and care for that patient? So we're going to know that if they're underweight and they're losing weight very quickly, then their diet needs to be managed. And maybe we pick a different diet based on their clinical signs, something that will help them keep the weight on. We're going to need to give them medications to suppress or to alter how that thyroid gland is working. We might need to speak to the owner because they've got a whole new patient and pet to look after. Maybe it's a cat that's never had anything wrong with them before, and now they've got all these different jobs to do to help manage this patient's condition. And thinking back to how, you know, if the blood pressure goes really high, then they may have vision loss because it will affect sort of the pressure in the eyes. Then maybe we've got a blind cat and we now need to change how they live and how we support the owner, provide a good quality of life for that. And then also this patient will change over time. So perhaps they're being really well monitored and the medication is working really well. And actually we can tailor back some of that care because we don't always think about it, but actually the care that the owners have to provide can really affect their livelihoods. We've had owners who don't go out together anymore, husbands and wives that don't go out anymore because one of them has to stay behind to look after that pet. And actually, if we can try and change and reduce down that care, then we're going to help the owner out in that way. Or maybe the patient's getting worse and actually we need to step up that care and we can support the owner with that. When we look at technology and engineering as part of STEM, I thought a good example is the cardiothoracic bypass surgery. And this is where we see some blood. So if you want to close your eyes, close your eyes. You can see here that the amount of equipment that is in that room, and someone needs to be running that. Now, cardiothoracic bypass surgery is a very extreme example. So they've got open heart surgery going on here on a dog, and you can see how many people are in that room. Now, not all of them are going to be nurses. Some of them are going to be vets. We've got perfusionists coming from the NHS. We may have doctors coming, surgeons coming from the NHS to support these surgeries if it's the first few times we've done them. But there's a nurse there who's running that theatre, trying to maintain the equipment, making sure that everyone's got what they need. And so you're going to need to understand the technology and the engineering behind all of this equipment in order to help that theatre run smoothly. Or maybe you'll be in there working and one day you'll think this could be done better, and you'll have that idea and you can go further into that side of things and look at developing equipment. We've got nurses doing that right now. So that's just a more zoomed in picture for those who are interested of just the level of equipment that's going through there. You've got sort of blood coming out of the patient, being sort of filtrated and going back in, working as the heart would whilst they work on the heart. I know I'm running out of time, so I'm going to be quick. We've also got some calculations. So for the mathematics side of things, we have fluid therapy, we've got drugs, we've got anesthesia, nutrition, chemical dilutions, post-operative checks, all these sorts of things will need calculations. And so although the level of maths is fairly basic, you don't have to be, you know, amazing at algebra and all these different things. It is just multiplication and division. You know, you do need to be very competent at that because you may be doing that in an emergency situation when the pressure's on. And I've put some calculations here, and I know this is being recorded, so if you're really keen to try and work them out, you can have a look at them and then try and figure them out, and I can give the answers in the chat. But we've got a simple medication calculation for tablets for a 1-week course of patient, through to a more complicated calculation where you're looking at how many millimoles of potassium there is in a fluid. And I think just something I wanted to finish on is that we've got the patient and the client in the middle, and then we've got all these different roles around the outside. And so maybe for you, you want to be a vet, or maybe you want to work with horses and go into sort of physio or farriery, or maybe you want to work with small animals and physio. All of those things are options. You've just got to sort of get out there and experience it and see which role you actually prefer and which one you think would fit in with your lifestyle and your preferences. So there's lots of different ways to be involved in that patient and client care. So I'll copy and paste these links into the chat, but we've got some sort of things to find out, some places to go to find out more information. So we've got our Royal College of Veterinary Surgeons website, which is our governing body, and they've got about nursing, but also if you're interested in veterinary, there's veterinary there. Again, you can have a look at the RVC website, that's got about vet, bioscience and nursing. We've got the British Veterinary Nursing Association website, but you can look at all these things, and I recommend you do, but if you're interested in a career with animals, please get as much experience as you can. Firstly, you want to see what the role actually looks like. We have lots of sort of beautiful programs on TV that make the role look amazing, and you know, we can do all these really mad different things, and it's exciting every day. You know, it is a job. There is the dirty end of the work, which you probably won't see on TV so much. So go there, have a look, see which role you enjoy, ask the different team members different questions about, you know, what they enjoy, what they find challenging. Go to farms, go see if you like working on a farm, that sort of thing. Just go out there and see it, because also that helps you stand out when you're sort of applying for these courses and there's lots of competition. We know you're serious because you've been out there and done what you can to see practice. So that's the end of the chat, and I know there's opportunity for questions, which I've eaten into, sorry.
That was great. Thank you ever so much, Sarah. So if anybody has got any questions, you can either come off mute and ask Sarah, or you can pop them in the chat. That's absolutely fine. So Sarah, when you were at school,
Yeah.
did you know that you wanted to do this? Was this always your goal in life?
Yes, which is a fairly common answer in veterinary. I think most people know that they want to work with animals. I don't think I knew I specifically wanted to be a vet nurse. I just knew I wanted to work in the veterinary practice. And then when I went and saw veterinary practice and I saw the way that the nurses interacted with the animals rather than the vets, I actually preferred the nurse role and thought, yeah, that's the one for me. And I kind of also knew I wanted to teach. So as soon as I was doing my degree, I knew I needed to do the degree because I knew I wanted to teach later in life. So yeah, I think most people who want to work with animals know that. But actually, if you just think, I don't know, I really enjoy taking care of my pet, go to a vet practice and see if you enjoy that. And if you don't, you don't. But if you do, at least you know.
Yeah, no, that's great. I think as well, that's a really good piece of advice, because sometimes you can think, oh, I really want to do this as a job, but because you haven't had any experience and you don't really understand it, when you actually do get there, you think, actually, I don't enjoy this as much as I thought I would.
Yeah.
And you could have wasted quite a lot of time. So it is good to go and get that experience first to find out that that's what you definitely want to do. I don't think there are any questions.
I was going to say, with animals as well, you definitely want to get that experience, because it does always seem like a really sort of lovely job, but there is the sad side of it and the difficult side of it, and it's a lot of emotional stress as well, and just sort of going, actually, this is hard, and the courses are incredibly hard. So it's a bit like you were saying, you don't want to get onto that course, get a year in, and then go, actually, this is not what I expected it to be. I mean, there's students who do that, and that's absolutely fine. You can't transfer to other courses, but it'd be better if you sort of went out there and saw it first.
Yeah. Okay, well, I don't think there are any questions. Nothing's come up in chat, so I will stop the recording.